Okay, hello and good evening, or hello at all. It depends on where the attendees are coming from. I warmly welcome you to today's webinar. Today we have a very special one because I have the pleasure to do this webinar together with Dr. Maximilian Reinhold. He's a surgeon at the Universitätsmedizin in Göttingen. And yeah, he's a specialist for orthopedics, trauma, and spine surgery, and in charge of the spine department at the Universitätsmedizin in Göttingen. So a few words to my person. My name is Karol Machura. I'm a product manager here at mediCAD HeckTech, and I'm in charge of a few modules, amongst others, the spine module. And so that's the reason why we'll do this webinar for today. A few things or a few words about the agenda. First, after the introduction round, I will head over to Dr. Reinhold, and he will show the case, tell something about the clinical topics there, and maybe some special things about the clinical case. And then after the introduction of this case, he will head over to me again. I will jump right into the software and show you how you can plan the case, how mediCAD 3D Spine can support you during the planning phase, and how you can prepare for the surgery then. Okay, some organizational things during the webinar, during the presentations. Feel free to write questions into the chat. We will answer them as good as possible. I think the more clinical ones will be answered by Dr. Reinhold. And yeah, questions about the software or the company I will answer. And if you'd like to, it would be great if we can start a small discussion round at the end of the webinar where you can ask any further questions you have. For that, I would suggest to unlock or to activate the speaking functionality and the camera function. And if you'd like to, you can join us in the discussion round. One thing further, I prepared a little survey, and it would be very great and very helpful for us if you can answer these few questions. There are 5 included, so it should be very fast to answer them, and it will really help us to improve ourselves, to improve the upcoming webinars, and get some ideas and suggestions for our software. Great, I think that's enough for the introduction round. So Dr. Reinhold, I would please you to start. Tell us things about the case. I will lead over the host. The host possibilities for you, and then you can start with the presentation.
Okay, warm welcome, and thanks a lot from my side for the invitation. I really much enjoy doing this, and I also think that a good opportunity to get both a little bit of clinical input. I like to present the case to you and start it right away. As Carol said, we would like to start this off with a rather typical clinical case. Carol will give you an introduction to the software with a demo, hands-on, basically how to do this, and followed with question and answers. So the case I've selected for you is nothing fancy or special. It's rather a typical case, but we believe this is what most of us are looking for. We want the software, or a software that supports us in our day-to-day practice, where we can efficiently do our surgical planning. So this is a typical case, a 66-year-old lady that I saw in my outpatient clinic with a typical complaint of combination of back pain and right-sided leg pain that we could correlate to the L4 dermatome. So a typical case. No motor deficits. She was on pain medication for quite a while, and had no relevant comorbidities. So, as an orthopedic surgeon, the first thing we do is we do our X-rays, typically in the upright position. When it comes to spondylolisthesis, I think this is mandatory. Otherwise, you might miss some degree of the slippage. In her case, this can be easily appreciated. It's the typical level, the L4-5 level. How to like measure this? This is something the software will do for us. We will show you in a bit. But let's continue. Most patients in my clinic, they come with an MRI scan. Some even have MRI scans before X-rays. So in her case, she came with these MRIs. This is a T2 scan, sagittal plane. If you will have a look here in the middle of the screen, you'll see that there's a quite severe central stenosis with a sequester right here that most likely causing her leg pain with some neuroforaminal stenosis that can be appreciated best in this image right here. So looking at the axial scans, this is what you will see if you look at the L4 level and above. You can see the sequester here. This is a severe degenerative lumbar stenosis. If you would like to classify it, I think the Schietzer's classification is a good one. This would make it probably a B to C grade spinal stenosis. Big time spondyloarthropathy with thickened ligamentum flavum, and according to her age, also some degenerative fatty atrophy of the muscles. So you will also notice that there's quite a bit of joint effusion here, assuming that this is part of the back pain problem. So a classic combination of neuroforaminal stenosis, central spinal canal stenosis, and some degree of slippage and instability. Looking at the scalp view on the left here in this slide, you can see that that she is obese, quite typical problem, at least in Germany these days. For a more detailed bony anatomy, we obtained a CT scan. This is also helpful for preoperative planning, assessment of bone and bony structures. There's quite some disc degeneration and some vacuum phenomenon that can be seen here, and also lots of arthritic changes in the bone. So, well, what's next? After having done the clinical assessment, you would most likely like to counsel your patient. You have the discussion about operative, non-operative treatment options. And as in her case, this will most likely be a surgical case because she has had some significant she has undergone some significant non-operative treatments. She had opioid pain medications, so with a severe stenosis. So she's a good candidate for surgery. So you need a good surgical plan, and that's about all for now for this case. A good time to hand over to you, Carol. And why don't you go from here and show us how to plan this case with your software.
Yeah, thank you very much for the case introduction. I think we get a good idea about the case. And yeah, I will jump right into the software. I think for that I have to get back the hosting possibility, and I will share now my screen. Okay, so can you see my screen?
Yep.
Great. Okay, thank you for the feedback. Okay, as you can see here, we have the mask of mediCAD. So this is the first screen you will see when you load the patient data. One important thing to mention here is that you have the possibility to integrate the software into your clinical workflow. So we have two possibilities to link mediCAD to your PACS system. So there are a few PAC vendors where we have a direct integration, so where you can choose the data direct in the PACS and then open mediCAD out from the PACS. And other way is that we have a tool which is developed by our own. And this is a function, or this functionality is to be a link between the PACS and mediCAD. So you can search for your patient data in the tool, which is called Query Client, and then you can choose there the patient data and load them direct into the mediCAD software. So we have here, all the patient data for that case. And you have the possibility here with mediCAD to plan with X-ray data, with CT data, and with MRI data. I've loaded for today the CT data and X-ray data. And for the workflow, I would start to show you the preoperative sagittal X-ray. And now I want to show you which possibilities you have in the 2D section of the software. So you just have to click on the image and then just load it. And by clicking on that, then start planning. So the first step is that that's obligatory that you do a scaling process to be sure that the all implant sizes you may insert into the planning software, or all measurements are in the right dimension or in the right size. After the scaling process is done, you have to choose the patient orientation and then continue. And here we are now in the main section of the software. On the left-hand side, you have the submodules where you can choose what or how to treat this patient case. Here you have the image, and on the right-hand side, you have all measurements created during the plan. So the heart of the software is the Sagittal Balance. We will dive into that directly. You can also do a different, you have a variety of measurements. For example, you can measure here the spondylolisthesis between L4 and L5. And of course, you have the possibility to do deformity correction or to see or to insert implants. But this is an interesting part I will show you then in the 3D module with the CT data. Okay, when you click on the Sagittal Balance, you have you are now in a guided wizard or in a guided workflow where we have to determine a few landmarks. I will do that in a very quick manner. And here on the left-hand side, it's the software says you what to do and shows you in what step you are in. Okay, I will restart the element, I think. Okay, and when you have patient data where the image quality isn't that good, I would go a step back. Yes, you have the possibility to manipulate the image in some ways. You can invert the X-ray that you have a better view on the osseous structures here, and so on. You have more possibilities to manipulate the image to get a better view on that. All right, so I will go through it very quick. When I do something not that correct or that precise, I hope that's not that bad. And when I do something wrong, I think, I hope Mr. Reinhold will tell me something about that then. All right, so we start with the sacrum. I will go through it very quick. I think this is, sorry for that. I started at the top plate of the plate of L4. I think the sacrum is more here. Right, so the next step would be determining the hip joint. Then we have to see where the C7 is. It's a bit difficult to see here on that X-ray. I think it should be somewhere here. Then we can draw in the femur obliquity angle to see if the patient balances any deformity. And the last two steps are to sign in the lordosis. And then we have a quick overview about the alignment of the patient. Now here you have the most important spinopelvic parameters, and then you have an idea about the alignment of the patient, and can think about then how you could treat the patient.
Yeah, that was quite quick and efficient to do all these measurements. I think if you do this freehand, this might very well take you 10 to 15 minutes if you do it on an X-ray without assistant or guidance like you did right now. It's good.
Mm-hmm. Yeah. Thank you for that information. Right. Yeah, and I think it will become faster as more often you do the workflow.
Yes.
Okay, so when we have all the information here on the left-hand side, and we have some more some more detailed information on the right-hand side, so that you can have an idea about the alignment. So I would now hide all the measurements and would go over to the measurements you can do manually. So you can draw in distances, angles, you can measure the lordosis manually, and you have a functionality to measure the spondylolisthesis here on this. And as you can see here, when you're not sure how to execute the function, then you have here a small demo video on the left-hand side in this corner, and then you have an idea how to use that. For this case, I have to recognize or to determine the L5 vertebra. Identify the, to restart the element. So this, the reason that you have, you can orientate here on this. So you have to start on the dorsal side, then go to the ventral side. And then you can recognize the slippage of the vertebra here. And this idea or the distance you have here on the result window. You can see here it's called C1, C2. I have the possibility to determine or to say the software which vertebra I do consider. For doing that, I can delete here this spondylolisthesis and can do that again. So if you want to execute measurements again, you just have to delete them with this X here, and then you can start again here. Choose now between which vertebrae you want to measure. It's between L4 and L5. And then you can execute the measurement again. It should be somewhere like here. Okay, and now you have the information about here the spondylolisthesis. I can hide that as well. And after I get these informations, I have the possibility to do a deformity correction. So here we have different options to simulate cuts. For this case, it would be interesting, yeah, just to cut a simple line. Apply that. And now we can move the section. Oh, sorry, we can move the section we've cut it. And then have an idea how much we have to move the spine for to correct the spondylolisthesis. So we have a slippage of around about 8 millimeter approximately. And now after the correction, we have less. And after that, we have also the possibility, if we want to increase the lordization, to increase that. And for example, have now an influence on the SVA line. So when I do, when I execute the correction, sorry for the angle, you can see now here that I come from the SVA line with a pathology, with pathological idea.
Chart, please, Carol? How to when you want to increase to zoom out and show the SVA line, is that possible?
Yeah, it is possible. For a better overview, I've hidden all the measurements. Okay. But of course I can bring them all back.
So measurements are on real time. They will adjust once you do the correction or simulate the correction. Is that right?
Yeah, right. They will exactly alter when I do the correction or when I simulate the correction.
Yeah. Okay.
Okay, so
that's an important thing to know how much lordosis you want to give her back in order to have a good alignment. Not so much maybe in a monosegmental pathology, but talking about lumbar scoliosis, for instance, this is a very important thing. Mm-hmm. It's nice to have in these pathologies too, like a monosegmental instability, like in this case.
Yeah. Okay. Great. And thank you for that. Yeah. And when you're common with all the functionality, you can determine all the or assess the alignment and correct it. Yeah, very fast, even in such or even in more severe cases. And now you see, okay, maybe I have to put a cage in here with a light lordization and to increase the lordization here. And as you can see here, we have a change now of the SVA line, and we have a change here from the lordosis. So we have an increasation here of the lordosis.
Very good.
And yeah, and when we are ready with the plan, and when we have now an idea how we could treat the patient and what we can do during the surgery, we have the possibility to export everything. I will click here again on that picture. So I click here on File, on Print and Export. And this is not the only way. You have also the possibility not to export that on your local device, so your planning PC or your planning notebook, for example. Mm-hmm. So this is one possibility. Here you have information about the patient, information about the surgeon who will execute the surgery. You have here information about the preoperative values and what you have planned. And when you did some screenshots, you can put them in here as well. But I will show you that in the 3D section, that we don't waste too much time here on the 2D one. And as I mentioned before, you have the possibility here to export that direct into the PACS. Now it's not active for me because I have not a connection for the moment to a PACS system, but you have the possibility to do that all time. And yeah, it depends on, doing a plan for a spine surgery is not obligatory at the moment, but when it will, you're well prepared with our software because you can now then send the plan into the PACS, and it's not possible anymore to manipulate that afterwards.
Yeah, I'm afraid this will come pretty soon, as we know from our colleagues in the endoprosthetic department, they have to do this. They have to provide a plan beforehand. In spine surgery, we are lucky enough not to have this for the moment, at least not in Germany, but I am very skeptical that this might not come very soon too in spine surgery.
Yeah, and for that case, yeah, you have a software here where you can be on the safe side. Great, okay.
Can I ask you a question? The X-ray looks a little bit funny. Did you invert it? Or why is it, it doesn't look like the typical appearance of a X-ray?
Yeah, right. I did an inversion, yeah.
Okay.
So you have the possibility here on the under this button to do to invert the X-ray.
So now it looks more like a
Okay. And I manipulated with you have the possibility to use your mouse wheel. By clicking on your mouse wheel, you can do a manipulation as well, to get a better view on the osteostructures here.
All right.
Okay, so as you can see here, you have a hint of the software which myading grade it could be after your measurement, and that you can use as well, for your preparation. Okay, so for this section, I think it's time now to switch to the 3D module. If you have questions now about that, feel free to ask them. Just write it into the chat. And if you want to, and if you have questions about this 2D module a bit later, then we can skip to it again. That's absolutely no problem. Okay, so when you don't have any further questions about that, I would now go to the 3D module. Okay, I think there will be no more questions. Okay, what I didn't do was you have, of course, the possibility to load multiple pictures or multiple images and kinds of images into one plan. So I could have chosen the CT images and the preoperative plan and could load that in one plan. Yeah, but now I did it step by step. Okay, now I choose the CT image by clicking on that.
By the way, can you use any CT images that you have in your hospital, or are there specific requirements in order to do the pre-op planning and measurements, or can you just use the CT scan as it is in your clinic?
Yeah, this is a great question. So there is a CT protocol which gives a suggestion how the parameters of the CT scan should be, that you can treat or plan the best way.
But a typical CT scan will do, right?
Yeah, it will be enough. Yeah. One point is the segmentation part. I will tell you something about in a few seconds, because this segmentation makes it important that you choose the right parameters. For example, it's better when you don't, or it's not allowed that you have a slice thickness over 2 millimeters. When you have more than 2 millimeters, then the software will not execute the segmentation. You can, when the segmentation doesn't work, you have nevertheless the possibility to plan, but then you will you don't have some of the automatic functionality. So that's the point.
We will see pretty soon how it works. Okay.
Yeah, right. Yeah. But it's the best way is to have a look on the CT protocol, and then let's do the CT exactly like it's in the protocol.
The size thickness, the better the image quality, basically.
Yeah, right. And the higher the image quality, and the better the segmentation works. So
makes sense.
Yeah. All right. Yeah, and just to have a look here, this is the segmentation section. It takes a few seconds. Here we have some soft tissues. I can delete that. And here you see what the software did. So it determines each vertebra, and yeah, it should looks like this. And then you have a good segmentation of the spine, and you can use all the automatic functionality, which makes it possible to plan very, very fast. So when you're happy with the segmentation, you can manipulate that in some ways, but I don't want to get into too much into detail about that topic. So I will just now accept and continue to the plan. Okay, now we have here different views. We have here our 3D module. Here you can see a lot of soft tissue left. For this case, you have the possibility to denoise or to use the denoise function by just clicking on that. Then it takes a few seconds.
I've noticed the same thing when I use big data, like big data, quote unquote, like a emergency shock room CT with 10,000 images. Let's say my computer tends to be a little slower, but with a normal CT scan of a lumbar spine, this is easily accomplished with a regular computer that doesn't need specific requirements for extra hardware. At least my desktop in my office is a normal computer.
Yeah, but that's a very good point. And normally when we install the software on a device of one of our customers, then we are very close to the IT services. And yeah, we suggest there how the system should be built up that the software works best. Yeah. And yeah, this denoising function is also a way to increase the performance of the software here and to make everything a bit more fluent. All right, so I use the denoising function, and now we have a good view on the 3D module. The initial data was an axial view, and the software automatically creates the 3D module and the other different views. So we have here a sagittal view and here a coronal view. And maybe as a hint, this 3D module is created by the software automatically, so you don't have to ask for that at your radiology. So the software does this completely automatic. All right, here we have, like in the 2D section or in the 2D module, some submodules. We have measurements, we can execute a deformity correction, simulate that. We can insert screws, we can insert cages, and yeah, this is so a very good case to show the functionalities here. I click here on measurements at first. So you have here also the possibility to measure the spondylolisthesis. Of course, this is a lying CT, and this is important to consider. Yeah, but I want to show you that it's nevertheless possible to do a spondylolisthesis measurement. You can do that manually or use the automatic function. So you can, I click here on auto, then choose between which vertebrae I want to measure, L4 and L5. Then I click on start. And here the software did the measurement completely automatic. So yeah, it's now here an offset of 4 millimeter. And if you want to check that, yeah, you have to recognize where the measurement is done by the software.
I've never done this in a CT in the 3D module. That's nice to know that it's also an option. I always used to do this on X-rays.
Okay, yeah, I think that's the most common way to do that on X-rays, because yeah, we have standing X-rays, and here the patient is on a lying position. Yeah, but now you can compare how severe the slippage here or the offset is in this lying position. Yeah.
Okay,
so
the computer never lies, but I would probably make this a grade 2 slip if I look at the X-rays.
Yeah, true. Great. Okay. And as you see, you have the different other measurements here you can use. Yeah. I, for example, demonstrate another case of scoliosis. So you have some scoliosis functionalities here. You can measure cop winkle, cop angle automatically, or the central sacral line here as well. Okay, but for our case now, yeah, the most important thing is the spondylolisthesis. I can hide that as well in as we did in the 2D module. Yeah, and now the question is how we can use the software now. So first of all, we can we can start with planning the cage. With what would you start with?
I would do the screws first. I'd like to see how you do the screws. Okay,
yeah, so let's start with that. We have the option to do that, the multiple screw placement. I would do that. First, you have the possibility to choose between monoaxial and polyaxial screws, and then the manufacturer. Yeah, this is the database or all vendors we have at the moment, but we are after it to increase the database so that you really can plan with the screws, with the cages, with the implants you are using in your operation room. So for this case, I would just take a Cygnus screws. I have now to decide which vertebrae I want to treat. So it's L4 and L5 for that case. And then I click on both and insert the screws. And the software now determines screws and checks which could be the best diameter and the best length for the screws. So as you can see here on the coronal view, the screws are inserted, and we can now go through the planes or through the slices to check if the software determines the right diameter. So we can go through now through the slices and see if the diameter is good or it's fitting or not. And you have here the information about which screws are chosen by the software on the right-hand side here on the result window. So you can check that this way. And you also have the possibility, and this is, I think, a very great function, you can manipulate the angles of the views. So when I click, for example, the a button on the keyboard, I can now rotate all the views in every direction I would like to. So if I want to have a look if here on the Sagittal view, the length of the screws are fitting, I can rotate the image, change the here the focus, and have now here a good idea if the length, and I can, when I look here on the Sagittal view, I can see here now, okay, is the length okay, or should I maybe choose a length higher or a length less, so a shorter screw.
That's a good one, that you have the option to have the view that you exactly need for your surgical planning. Many times the radiologists, they mess up the CT scan in a way that they do cuts in a strange way that you cannot really use for, let's say, measuring screw lengths, etc. So this is something I really enjoy and take advantage of, that I can exactly have the plane that I want for my surgical planning right here.
Yeah, great, good to know. And yeah, this is one of the advantages of the software. And I could imagine even on scoliosis cases where the angle or the rotation of the vertebra is different on different sections, then you can rotate here the coronal view and get a very good view on the pedicles, for example. Yeah, and so you have here the possibility to check everything like that. And now we can go through all the planes and decide, okay, now I have an idea how thick the screws should be later in the surgery.
How about angulation of the screw? In this case, I think the software did a pretty good job on to determine the trajectory, but how do you adjust this?
Mm-hmm. Yeah, you can do the adjustment. So for this case, I leave that, and you can manipulate each screw individually. So I click here on the screw, L4, on the left pedicle. Click on Edit, and now I have the possibility here to manipulate all orientation of the screw.
Yeah.
Yeah, I can, for example, have a view here on the 3D module. I can switch to a transparent view to have a good view on the screws, and have a look what the software did. Mm-hmm. And when I want to change something, for example, choose a thicker screw or something like that, I can do that here on this section. Here I can choose different tulip types, or here can change the diameter and the length of the screw. Mm-hmm. Okay, so and that way I can manipulate every screw. And here we have another option I will show you. When I click on File, Settings, I have the possibility to turn on the contour of the implants. So I click here on Show Contour Behind Slides, for example, and then click on OK. And then you can see here the contour of the screw in every slice. So I can open that up, and I can make, for example, a snapshot of that and save that snapshot, for example, direct to the export. And so you can do as many screenshots in every plane, every view you would like to. Okay, I will turn that off very fast. Okay, so any questions more about?
That indeed was very fast. I can tell you've done this a few times. I never get to these settings as quick as you do if I want to make any adjustments. I like it.
Yeah. I did a few plannings. Yeah. So and when you get in touch with all functionalities and all submodules, then I think each user will find your own workflow, and then it become very fast, especially on such.
Do you provide training if you are new to the software? Do you do this?
Yeah, that's obligatory. So we are a medical. Our software is a medical device, and especially here in Germany, it's obligatory that we did do training when you first buy the software. You have to do a training with us, and but besides that, when you have questions or when you own the software and have questions or problems, technical or with the software itself, then you can contact us every time, and we will see how we can support you. Yeah, so this is a very important thing for us to support our customers. Every time and in every case, it's needed. Okay, so
the screws look good. How about the cage?
Mm-hmm. Yeah, this is a good question. So we can now go over through the cages. I would show you today the manual cage placement. I click on that, and now we have to choose between which vertebra we want to insert the cage. I click here on between L4 and L5. Here again, choose the manufacturer. I would also use Cygnus for that case. Yeah, and now for today, I would choose a TLIF cage. I think that's something you use in the real surgery. Is that right?
Yeah, that's correct. That's what I do most of the time.
Okay, so I would, for example, use this Mobis from Cygnus. And here we have now the possibility to choose a cage with low dosation or without low dosation. I would now choose here, for this case, maybe 5% low dosation to increase that a bit. And now we have here to determine the height. What we've could done before, we could measure the height between two vertebrae, which is not that pathological. For example, here this one. I did that before, so I know we should use here a 10 or 9 millimeter
yeah, and we also did
high cage.
We did this when you showed us the cut. Then we were able to see how much correction we want and how much height we want to reach to restore. And so you usually know this beforehand by measuring. I agree.
Okay. Good. So I insert now the cage. Yeah. So this is you have for the moment you have to do that manually. So choose the dimensions of the cage, but it will be inserted automatically by the software. Okay. What the software did is it executes a cut and then inserts the cage. And we have now the possibility to manipulate everything. So the position of the cage, the rotation and the angle, and we can have a look if the size and the dimension of the cage is in a good good for that case, or if we maybe choose a higher cage or a smaller one or a bigger one, something like that.
Yeah.
Yeah. And of course, we can also correct the offset. For that, after we've inserted the cage and assess the parameters, I can leave this subsection, go to the deformity correction, and now we can see here the cut which was executed by the software. So I click on that and have now the possibility to manipulate the cut. So I can now move the spine a bit more backwards for correcting the offset, for example. But the software did it by itself by inserting the cage. So I think that's a good way here. And we can now have a look here on the spondylolisthesis.
It reduced the slippage automatically too. That's funny.
Yeah, right. Yeah, but it's good to check that after the insertion of the cage, and you can see here now the difference. And yeah, okay. And the last step would be when you inserted the cage and did the corrections, so correct the offset. Then you have the possibility to insert the rods and get an idea how long the rods could or should be. So I can here click on multiple screw placement. And here we have the rod function. I click on both and insert the rods. And now the software will insert the rod on both sides. And here you have now an idea how long they could be. And this might be also a good information before the surgery. And here you have all information about the screws, about the cage, about the correction of the spondylolisthesis. And you can export that, and the information of the diameter of the screws and the cage you can give over to the team in the operation room and ask them to prepare the operation room a few hours before or a day before. And this is a point where you can save a bit time for the preparation.
That's right. The scrub tech always want to know beforehand what screws they should take out of the shelf. And they hate it if you send them many times back and forth. Now I want a longer screw, shorter screw. It's good to tell them, take this and that out of the shelf, and you'll be fine. We'll have happy scrub nurses too then.
Great. Yeah, this is one of our ideas behind the functionalities. Yeah, and okay, I talk a lot during the presentation here, but when you're concentrated and when you concentrate and do the steps, and it's possible to do the plan very, very fast. You can use all this automatic function You can use the automatic screw placement, the automatic cage placement. And then I would say for a planning without so much talking, it would take maybe 3 to 5 minutes to do the plan. Yeah. So, and get an idea and a good preparation for the surgery later. Mm-hmm. Okay. And here you have the possibility as well with the PACS button to send it direct to the PACS, or go over or export that locally. So I click here on export.
Yeah, then you can print it out and take it with you in the locker room or the OR.
Yeah, right, yeah. Yeah, and again here you have the information here about the surgery, the surgeon and the patient, and here about the screws the software have chosen, and the cage, and here again about all measurements done during the plan.
Good.
Okay, so yeah, we are finished with the plan, and yeah, I hope you get an idea how the software could support you during the plan and give you the possibility to get well prepared for the surgery. Are there any points I forgot to mention, Dr. Reinhold, maybe? And thank you again for supporting me during the plan and for your hints and comments during that are very important points you've mentioned during the presentation.
Mm-hmm. I'm just typing in if anybody has any questions left.
Yeah, thanks for that. Yeah.
No questions. That's good. Everything is straightforward.
Yeah.
Yep.
Great. Okay. So I think we are nearly done. We planned to do a small discussion round. Yeah, if you would like to do that, yeah, just write in the chat.
Or turn on your video function. That's fine too. We like to see you.
Yeah, of course. Okay,
I think have to, if you don't want to, that's fine. That's good.
Yeah, you don't have to. Yeah. but I can give you or can turn on the.
Ah, there's one.
Yeah, right.
Khaled.
And so I hope it's okay that I turn now on the speaking section. If you would like to, you can ask something about the software, about the case. I will turn on this. And if not, it's absolutely fine as well. I've mentioned a short survey at the beginning. I have to open that up just a moment. So it would be very, very helpful for us if you would take the few seconds to answer the survey. There are just 5 questions included. Yeah, and that would help us. Okay, when you have any further questions, I will type in my email address. And you can write an email direct to me if you have further questions, or just want to be in contact with us. So we've shown you the spine module. We have other modules, for example, for shoulder planning, and for hand, for hip, for knee, and stuff like this. So when you have questions about that, then you can go to our website and stop the sharing now for a moment. You can go to our website and get there a few more information about yeah, all software modules we have in our portfolio. Okay, so when there aren't any further questions, I have to thank you a lot, Dr. Reinhold, that you did the session with me today.
No problem.
Yeah, it was a pleasure and an honor to do that together for today. Yeah.
Cool. Yeah, so in this case, I just like to thank you that you showed the software to us. In my hands, it's a good tool for my everyday practice. I use it a lot, especially in difficult cases. But this sample was to show you that it's also feasible and doable for standard problems like a degenerative spondylolisthesis case. You know the screws, then you know the pedicle dimensions, and you get an idea what cage and rod to put in. So it's a usable tool, and I would like to say bye-bye.
Yeah. Okay. Thanks, and I would say goodbye as well. Bye-bye.